Thank you for joining us today, this morning. First of all, hafaday, terudo, and good morning. My name is George Cruz, and I'm the Commonwealth Medicaid's new director. Today, we are pleased to announce that our office officially begins services here at our new location on the second and third floor of the Horiguchi Building here in Garapan. For those who are not aware, it's directly next to Cristo Rey Church on Beach Road. For the last few months, our team has worked hard with local government agencies and our federal partner, the Center for Medicaid and Medicaid Services, to complete the move. This location provides added benefits to our beneficiaries, providers, and the CNMI community. The new location in Garapan is more centralized compared to Capitol Hill, which gives stakeholders greater access to our services. One of the areas our stakeholders will recognize is the organized and spacious parking lot, both here at Horiguchi and across Cristo Rey Church. At our previous location in Capitol Hill, the parking was very limited, which forced many of our visitors to park on the side of the road. The building is safer and has greater security for our staff and customers, with 24-hour CCTV, and requires keycard access to gain entry at certain hours. Our current office location has more workspace for both our stakeholders and our staff. The previous location was not adequate and posed a fire hazard and unsafe conditions for both those we served and our staff. After weeks of meeting with our local Medicaid staff and consulting with the Centers for Medicare and Medicaid Services in the spring, we concluded that we needed more workspace to better serve our beneficiaries. Hence, we are here now. To help put this into perspective, the Commonwealth Medicaid Agency currently serves more than 19,000 beneficiaries in our community. That is nearly half of the CNMI population. With that, I want to thank you. I want to say thank you to my staff for continuing to provide outstanding customer service every single day, even during this move. I know it was a little hectic at times, but we all worked together as a team and made it happen. Lastly, thank you to all our Medicaid beneficiaries for your patience. This relocation is one piece of a bigger plan to improve Medicaid and Medicaid services to all our beneficiaries and providers here in the community. A vision that we have to providing you the best quality service to meet your needs. With that said, I now open the floor to any questions.
Let's put it in your own words. Medicaid has just moved here to the Horiguchi Building?
Yes.
Okay, and it's access to everybody. Does everybody who's on Medicaid need to come in to re-register for Medicaid every year?
At this point in time, yes. We are currently working on a system to put a system in place, an electronic system to better serve all of our beneficiaries, also in Tinian and Rhoda. The goal is to be able to allow our beneficiaries to actually apply online, so they don't need to come in. The only time they would come in is if there's a need to do a face-to-face to clarify anything within their application. We hope to have that completed in the next 3 to 6 months.
Awesome. So you got your new location here. We can hear that they're still working on it too. Yes. So you got a lot of growth. How much of the space? Is it all of the second and third floor?
No, only half of the second and the whole third floor. So one of the things that I experienced when I came in December of 2024 was we were very understaffed. This was the reason with a lot of our delays in applications, a lot of our delays in getting the cards out, delays also in regards to paying our providers. And so when I came on board, we had approximately about 17 personnel. As of today, we pretty much doubled that. And a lot of the resources we put in is in eligibility to help with our beneficiaries process their paperwork a little bit faster. We're still catching up, but we're better than we were before. And then the other part where we put a lot of our manpower is also in our claims department. And so I'm very happy to say that for fiscal year, we closed out fiscal year 25, processing over $120 million worth of claims for reimbursements for both off-island and on-island.
Do you have agents in the hospital? So if someone were sick and doesn't have Medicaid, for example, can you go to the hospital and will there be someone there from Medicaid to relate to? Are they going to have to get out of their hospital bed and come here?
Yeah, no, actually, we do have MOUs in collaboration with the hospital and some other agencies that work directly with clients with disabilities or those that are homebound. And so we work with their social workers, et cetera, to help process their applications for them. So those that are in the hospital, they're admitted, or those that are homebound, can't get out of their bed or leave their home safely, we have agencies and other individuals that we work with to help process their documents with them.
That's great. Now, how about you mentioned like nearly half of the CNMI's population is a Medicaid recipient or
Yes.
customer, client? What's the proper
Beneficiary. Call them
Beneficiary.
beneficiaries, yeah.
That's great, which is pretty massive. Now that today's the day they're supposed to come out with the new revised budget and everything like that. I think our match is at 17%.
Yes.
And that's pretty low compared to the mainland, right? Isn't the mainland?
Well, it's low, but it's a good low. That means that the CNMI government only matches 17 cents to every dollar. So it's one of the lowest, and it's not just the CNMI, it's all the territories. We have that matching except for Puerto Rico. It's a little bit different, but we're one of the lowest in the United States in regards to that matching.
Which is great.
Yes.
I know they're working on that revised budget. Have you gotten a heads up from anybody that, hey, don't worry, we're going to be able to give you guys the local match?
We do have local matching, and from my understanding, it's not being revised from what was allocated from the 179 budget that was passed. So that's a good thing. I do want to, because I have gone in record with this with both the House and the legislature, is the CNMI Medicaid, and this is something important for the entire community to know, we've never been fully funded, which means that 17% has never been fully matched. And so we've been working with what we can and what we have, which this fiscal year is no different either.
So how do you do that? How do you fill that gap, or do some folks just go underserved?
No, we do our best. By law, we need to make sure that we provide as much services to those that are beneficiaries. And so one of the ways, at least coming in for me, is we want to look at more preventive services than just both acute and treatment services. And those are important. We do need to continue to support that, such as CACC. But I think if we take a positive approach by addressing more preventive care and preventive services, we can prevent and lower our healthcare costs long term. If you recall, during the SOCA, that was actually one of the things that Governor, the former, actually the late governor, Palacios stated, was that he's committing $5 million out of the Medicaid budget to go towards preventive services. And so we're keeping up with that. And so we will have a little bit more information later on at another time, hopefully by the end of this week for you, in regards to what they call the 1115 demonstration waiver, which the CNMI has never done before. And so it's an opportunity for us to look into different programs, different ways of doing things to again address a lot of the healthcare, the chronic disease that's going on, and to control it, but also to prevent it from happening. So again, long-term wise, we can control our costs for healthcare, off-island referrals, et cetera, et cetera.
Is the local Medicaid concerned about the federal shutdown, government shutdown, which is partially shut down because of potential cuts to Medicaid?
Yes, actually, well, one of the things with the OBA bill or act or law, we were not touched, as in the territories. So of course, the bigger pictures are mostly the states, right, where we're talking about billions of dollars. But here in the CNMI and Guam and American Samoa, and also USVI, Virgin Islands, our budgets were not touched at all. If anything, actually, we're very happy to say that we had approximately a 2 to 2.7 bump increase in this year's funding for our Medicaid program. So we're very happy about that, and that's why we hope to continue to do the work we're doing. Again, to catch up, we pretty much have closed out fiscal years 22 and 23. Actually, sorry, 23 and 24 in regards to payments to providers. So we have really caught up. Again, that's a testament to my team, our claims team. They were working hard throughout the day and even working, extra hours to ensure that we get our providers caught up.
You made a really great statement about preventative care. I remember speaking with CEO Munya over at the hospital, and she mentioned something about that years ago, that as the de facto public health secretary, that it's better to get those things early instead of when they become big things later.
Correct.
Now she was just recently appointed as the territorial health official for overseeing and communicating directly with these folks. Does that change anything with our Medicaid office at all?
As of this moment, no. I don't have any further comment on that. Actually, Dr. Munya has been our territorial health official for the past few years already, so that nothing has changed on that side. But we just look forward to working with her and her team constantly. I mean, out of the $120 million that we were able to reimburse to providers, CAC got a huge bulk of that. And so, hopefully that will help in regards to their operations as well as services that they're providing.
You ran a private health service for a long time,
yes.
The organization. Just from your perspective on that, is there any potential conflict from having the person who's running the hospital make those kind of decisions also?
There could be. I mean, if you're still currently in the position, that's actually one of the things for me. I retired from Marinus Health, and so the governor gave me a call, I guess, when he found out that I was retiring, and again, the late Governor Palacios, and I told him, I said, I'm here to help, and I'm not looking for a job, and this is a passion that I've been involved in for many years, from youth activities to the community. So this is just something, at least for myself, I can't speak on behalf of Dr. Munya, but I think if any of us have an opportunity to give back and help improve our community in whatever capacity, I strongly suggest they do it, because we need it, especially in these tough times, this fiscal year especially.
Is there a budget for artwork? Because that's pathetic what's behind you.
Unfortunately, this room is not done, so we're not here 100% yet. We still have some staff that are lingering, including myself, up in Capitol Hill. But all of majority of our services are here. So second floor are for all our beneficiaries. So we have a nice location for them.
Is there a call to artists around the island who?
Actually, that's a great idea. That's actually wasn't my thought, and I wanted to do that. Because this represents the community, right?
There are patients who
I
make
agree.
artwork. That
I
would
agree.
be a great idea.
Yes, I definitely agree. Yeah, and that's something I think we would do, because I saw that somewhere where even all the doors, and when I was in a conference and I visited a clinic, and all the doors had local paintings on them, and I thought that was an awesome idea. Yeah.
So you've got the new digs.
Yes.
It's opened up for the public. They can find you here. Phone number still the same?
Yes.
Anything else changed?
Yeah, phone number is the same. Yes, everything is still the same. Yeah.
Whatever's there is the phone number?
Yes.
Okay.
And for our providers, they actually can come up on the third floor, and so we have an intake window for them as well. Oh, one of the other great news that's very different from before is we are now open Monday through Friday here in Saipan, 8:30 to 4 p.m. And why is that different is because as at our old office, we were only open from 7:30 to 1.
Oh, wow.
So now we're opening. Fridays we're still going to be closed because things are still done manually, and that's our opportunity to do our due diligence, to be calling, looking to records, complete all the tasks that have been compiled throughout the week. So, but
is
for
the
the public,
office on austerity as well?
all government agencies, including the Medicaid agency, is on austerity. Yes.
Okay. So Monday to Friday, except for austerity. Whenever the austerity rules click in,
Well, no, actually Monday through Thursday, 8:30 to 4. That's our austerity. But then Fridays we're closed. We're still open with our staff. It's just that's an opportunity for us to catch up with calling, verifying properties, income, things like that. So because we get there's days where we get over 100 some clients a day. Again, we're servicing 19,000 beneficiaries between Saipan, Tinian, and Rhoda.
Are
So
there
it can
going
get
to be more clients because of the austerity? Are people going to fall underneath the Medicare limit and then move into Medicaid?
We are anticipating that, unfortunately. You know, with the right now, I know the government is going through a 70-hour per pay period, and so even that 10 hours, there could be a good percentage of individuals who weren't qualified possibly before for Medicaid who might now qualify. We are anticipating that because, again, and we're only thinking government. This is not, we're not even looking at the private sector and how this is going to affect. And you know, it's a trickle down effect. And so even if we get about 1,500 new clients in the fiscal year, that means we'll be serving over a little bit over 20,000. That now means that we're servicing, depending on what census you look at, we'll be servicing over 50% of our total population. Now, is that a concern? Definitely, right? And it should be a concern, you know, for the community, our legislators, all of our leaders, because that definitely now puts a huge burden on the Medicaid program as well. So,
Yeah.
all right. Thank you.